Hello and happy Monday. Welcome to another Purse Strings Money Monday. My name is Maggie Nielsen and I'm here, partner at Purse Strings. We're all about providing some tips, tricks, pieces of education to get those wheels turning. But then when you're ready to buy some Medicare, plan for retirement, need a will, a trust, getting divorced, getting married, we have Purse Strings approved professionals willing, ready, and able to serve you. Andrea is one of them, and we're so excited to have her on today to give us, the 411 about Medicare. But before we dive into all that fun, could you give us a little intro of who you are and what you do?
Hi, Maggie. Thank you so much for having me today. I'm Andria Bovey. My business is Bovey Insurance. I was previously in Seattle, Washington, but now I'm coming to you from Yuma, Arizona, which is the lettuce capital of the United States.
Who knew?
Who knew? So my business is comprised of three primary things: long-term care planning, Medicare health and drug plans, and I have a very sweet product for the under 65 marketplace that's an alternative to the Affordable Care Act.
Awesome.
And
Well, we're so excited.
we're focusing on Medicare today. So
Yeah, well, we're very excited to have you on and have you to bring your expertise. Anyone tuning in, if you have questions, you can throw them in the chat. If you're watching the replay, you can also, put them in the comments. We'll work on getting back to you on those. But just let's start with the basics. Where should someone begin on their Medicare journey?
right. So to define, Medicare is our health insurance program when we turn 65, and I'm approaching that age rapidly. Closer and closer to that every single day. And then some people who have certain disabilities are also on Medicare prior to the age of 65. And so I recommend people start thinking about this about 6 months before their 65th birthday. The very first step people will do is they will go to the Social Security office and sign up for what is called Medicare Parts A and Medicare Parts B. Caveat: sometimes people work past 65 and have creditable coverage through employment and delay signing up for Medicare Part B. But generally speaking, ahead of the 65th birthday, at least 90 days ahead, go to the Social Security Department and sign up for Medicare Parts A and B. Would you like me to define A and B for you?
Yeah, I was going to say, we get a little bit more info than the letters.
Yes. So that's that red, white, and blue card that you see posted on television and that people carry in their wallets. And Medicare Part A is inpatient hospital, and Medicare Part B is doctor and everything else that is a Medicare qualified expense. Part A, hospital; Part B, doctor and everything else.
So then
And
I think
I do have little cheat sheet guides and things that I can always provide by email and stuff, learning the basics of Medicare, that kind of thing, to people.
Awesome. And I think there's also then parts C and D, correct?
Yeah. So there are definitions to that. Let me stay on A and B for just a second. Typically,
Yeah.
there's not a premium associated with Part B. People have worked enough creditable quarters in their lifetime, and so they have Medicare Part A, the inpatient hospital side, for no premium. But Part B does come with a premium, which is why people that continue to work don't sign up for Part B. So in 2023, the Medicare Part B premium is going to be $164.90. So as we work with numbers today, let's just round that off to $165. So Medicare pays about 80% of our expenses. And so then people add on another layer of coverage to cover that additional 20% that would be the individual's responsibility. So right now we're in Medicare season, the annual election period for Medicare, and every other commercial on television is for what is called a Medicare Part C plan, also known as Medicare Advantage. So when somebody's turning 65 or considering their options and maybe wanting to make a plan change, there are two ways that individuals plan for their own responsibility for Medicare. One is called a Medicare supplement plan. Those also have letters. Think Medicare Plan F, Medicare Plan G, Medicare Plan N. Those are the three most common ones in the country today. That's a Medicare supplement plan. And then there are Plan C's being advertised on television right now called a Medicare Advantage plan, known as Plan C. Isn't this a horrible way for this country to name all of these plans and try to figure them out?
You could only do letters. I mean,
Only do letters, and it's a strange way to do it. So I'd like to define the difference between a Medicare supplement plan and a Medicare Advantage plan for anybody who might be listening, because they work very differently. So my mother, who's right across the street from me, has a Medicare supplement plan. With a Medicare supplement plan, she has a Plan G. She can see any doctor in the country she'd like to see. So when my father was still alive, they spent half of their time in Idaho, half of their time here in Arizona as snowbirds. So she could have doctors in Idaho, doctors in Arizona. She could go see anybody she wanted to in the country, and she could have doctors see any doctor taking Medicare across the country. It also, a Medicare supplement plan doesn't have a network. It doesn't have copays, and it doesn't have a maximum out of pocket, but it does come with a premium. So I did a little research, Maggie, before we got on the call. And right now, for someone just turning 65, a Medicare supplement plan G would be about $200 a month.
okay.
Okay. So we just talked about, so that's not, I pay more than that for my individual under 65 health insurance right now.
You
So
and me both.
with the Part B premium of $165 plus 200, we're now at about $365 a month for someone turning 65 and aging into Medicare. Turning 65 and joining the Medicare beneficiary rolls. So my mother, with her supplement plan, really doesn't see a bill for anything. Whatever she needs and is approved, and she works it out with her doctor for that premium per month and paying her Part B, most everything is covered for her. There's a little nuance with the plan she has where she has to cover a Part B deductible first, but it's a small amount of money and whatnot. And in addition to that, she has a standalone Part D plan. You asked earlier about a Part D plan. With her supplement, she fortifies that with a standalone Part D plan, Part D for prescription drug coverage. And her plan is about $30 a month. So with someone aging into Medicare with her $165 Part B premium, the premium for the Medicare supplement Plan G, and the standalone prescription drug plan of $30, the cost is about sorry, I can't see very well these days, $395 a month. So about $400 a month, and most every bill a Medicare beneficiary would have would be covered under that Plan G and Part D drug plan and original Medicare Parts A and B.
That's not terrible.
No, not terrible. If it's affordable, it's a great way to go. I believe that's going to be my plan when I have to make that decision. And now let's talk about these Part C plans, if we could, that are being advertised on TV today. Would that be okay?
Yeah.
Yeah. So then we have another kind of policy that a lot of consumers choose today called a Medicare Advantage Part C. And you see them advertised on TV right now. They come with hearing benefits and vision benefits and um, all of these extra things, and they advertise that they have no premium or a very small premium, and that's very true. I have right here in my county 2 plans, one that has a $34 a month premium and one that has a 0 premium, and the drug plans are built into those plans. So why are they so much less expensive? Because people leave Medicare, original Medicare Parts A and B. Medicare pays the plans to manage people's care, and so they're getting paid by the government to manage people's care. So a Medicare Advantage Plan C has copays for certain things. So to see a specialist, usually there's no copay to see your primary, but if you need to see a specialist, um, um, typically you're paying a $40 copay every time you go to see that specialist. If you're in the hospital, you've got a copay to pay for the first few days in the hospital, the first 1 to 4, 5, 6 days, and that can be $250 to $300. So there's if somebody were to be hospitalized with a Medicare Part C plan, they've got some coverages to pay. If you have labs, there's a copay for labs. They also have a maximum out of pocket. So if somebody has a bad health year, that particular policyholder could be liable for $4, $5, $6,000 worth of costs for that year as a maximum. I had a gentleman who switched from a supplement to Medicare Advantage. He said, I'm very healthy. I want to save the money. Well, he got diagnosed with cancer in that year, towards the end of the year, and had to go through a series of chemotherapy and radiation. And he hit his maximum out of pocket in that plan year.
Mm.
And then the maximum resets the following calendar year. And he had some treatments that also hit that next maximum out of pocket kind of thing. Medicare Advantage plans also have networks, so you need to see in-network doctors, and they're typically designed like a traditional HMO or a PPO plan like people are used to having, but everything's wrapped up in it, and a lot of consumers really like them.
Mm. So yeah, it really depends what's your best fit.
Mm-hmm. So people want to just have a premium, have everything covered, not have to work with a lot of paperwork, or used to copays and out-of-pocket maximums and don't mind to have a doctor in network, that sort of thing.
Got it. And so what if, we were talking a bit about how people work past 65. Do they have to take these benefits right now, or how does that kind of work?
Such a great question, Maggie. So sometimes people are employed in companies and their health insurance is provided to them well past the age of 65, and so they'll delay applying for Medicare Part B, and they don't purchase one of these plans until they actually are done with employment. And I won't get into the finite aspect of it, but the rules can be a little different if it's a small employer, 20 employees or less, and a very large employer. But yeah, a lot of people do that because they have what is called creditable coverage and can then have a special election period when they're no longer working.
Interesting. And so the Part D is the for the prescriptions, and I feel like there's something around that where if you don't buy it right away, you get penalized. Is that true?
Oh, that's so true, Maggie. Yes.
This is always a weird rule that I always think we should bring up because I think it's so odd. It sticks with me.
Called a late enrollment penalty. So if somebody turns 65 and they opt not to get a prescription drug plan and they don't have a creditable coverage of one through an employer, for every month that you delay, there's a late enrollment fee if you choose to purchase a drug plan later. So for instance, I just calculated one for a gentleman here in my county in Yuma, Arizona, and he has not had a drug plan for roughly 80 months. So his late enrollment penalty, I'm estimating, would be $26 a month, and that's forever and ever. He can't ever outrun that late enrollment fee. I don't know why I keep saying that wrong. Late enrollment fee if he wants a drug plan.
So it's not just paying back those months, it's forever. He'll always have an extra $26 fee.
That's correct.
Do you know why they do that?
It's something that the Bush administration put in place, and I'm not sure why they did that. I assume it was, I don't even want to make an assumption. I don't know why it's in place. It doesn't make a lot of sense to me,
Right.
or why it's even important.
Wild, but we just know. Now we know, and that's what we have to work around.
Right. And so I always advise people to get a very inexpensive prescription drug plan when they turn 65. I live in Yuma, Arizona. It's practically on the border of Mexico. People go from here walk into Mexico and buy prescription drugs in Mexico. And so a lot of people in this county, I was very surprised, don't have a drug plan. And then they get into their 80s and they can't walk across the border into Mexico.
Right. And so as we can see here, there's a lot of different options, a lot of different ways to kind of combine these plans. What's your role in this? How do you help people kind of decipher it all?
Yes, I think it's very important to work with an agent. And so I help people figure out if a supplement or an advantage is the right one for them. I don't like that consumers might buy an advantage plan based upon a television commercial when it may not be the right fit for them ultimately. And it doesn't cost people any more to work with an agent. I just have a real strong feeling that people should have an agent to help them if any claims and that kind of stuff comes up. So, and I only get paid if people place a policy and I'm the agent of record. I'm happy to chat with people. I'm not sure I addressed your question.
Yeah, so you would set up a meeting with them and kind of understand their needs?
Absolutely. Mm-hmm.
And then who are you? Are you paid by the client, or are you paid by the Medicare
By the
system?
insurance carrier.
Got
So,
it.
and I think one of the things an agent can do that is the strongest is helping people find the right drug plan, for instance. That's one thing that should be looked at every single year because there are formularies and tiers and there can be a pharmacy that is a preferred pharmacy that delivers a lower cost.
And so, kind of diving into that, if you're on Medicare and have your plan, is this something that you should assess kind of every year and meet with you every year to make sure it's still exactly how it should be?
As a general rule, yes. Um, my mother's on a supplement plan. She will be keeping that plan forever. She won't ever be changing her plan. And so she's set up for a number of years. I've got people on Advantage plans here in my county that will probably not change for many years to come. But if people find that their doctors are not in their network or they want to see somebody that isn't in the network, if their prescriptions, if all of a sudden they need to take a prescription that is really costly, that's a good time at the end of the year to reassess their drug plan. Or if somebody moves, and they have an Advantage plan, they're now out of network probably, and that'll give them a special enrollment period, and we need to look at something else. So every year, if people really like to do that research, every few years, if you just like to let things roll, unless there's a special circumstance like a move or something that changes, a doctor leaves your network or that kind of thing.
Awesome. I feel like this has been a ton of great information. Is there anything that we didn't touch on today that you want to make sure is shared with our community?
Don't wait until the day before your 65th birthday to figure out your options. Really get signed up for parts A and B, okay? And the other thing people don't realize is that they think their coverage is going to start on their birthday, and it's actually the first day of the month of their birthday. So, for instance, if you had a March birthday, your Medicare coverage would start on March 1st. Caveat, if your birthday is the first of the month, your coverage starts the first of the month, the prior month.
Those are good points.
So, and that throws people, and some Medicare agents don't remember that. It's a little funny rule, but if your birthday is on March 1st, then your coverage is actually going to start on February 1st.
And we did have a question come in that says, can a couple each choose their own plan?
Absolutely. They're individual plans, and it's very common for people to have different carriers in a couple.
Awesome. Well, I think this was filled with a ton of great information. I appreciate you coming on today and sharing your expertise.
I so appreciate your asking.
Yeah, if anyone has any questions, don't be afraid to reach out. Her email's been going through the bottom. You could also reach out to Andria off pursestrings.co, since she's one of our purse strings approved professionals. And like you said, it's free to have these conversations. And so, call her up, ask the questions that you have, and make sure that, you're covered and you're not paying these extra taxes that you don't need to pay, or fees. And
I'd like to bring up one more concept here at the end, or one more point. And I think we covered a lot of ground in very little time. These Medicare Advantage Part C plans sound too good to be true, and people say that to me all the time. It sounds too good to be true. And I do want to point out that there are some things that might make you feel like it is too good to be true. Remember I said that Medicare is now paying the plan, United Healthcare, Humana, Aetna, to manage people's care? That means that they're going to manage people's care to do what? Save money for the carrier, right?
Yeah.
So with a Medicare supplement, when my mother needed to have her hip fixed because she fell in and broke her femur, she and her doctor and the hospital decided what needed to happen and the kind of surgery she needed to have. On a Medicare Advantage plan, things need to get approved, and they could have wanted to do something lesser than my mother had. I'm not criticizing the Medicare Advantage plans, but they are managing people's care. And their interest is in saving costs.
That's a great point.
Obviously. And they are certainly affordable. So if budget is an issue, a Medicare Advantage plan might be the way to go just based upon budget, but I always encourage people to save up a little medical emergency fund to cover those out of pockets and the maximums so that you don't get startled one day with something serious.
Definitely.
Yeah.
Someone did write in, how do they get that guidance document?
I didn't hear.
How do they get that guidance document?
This one that I've got?
Yeah, should they just send you an email?
Yeah, send me an email. And if you want to talk to me, there's a calendar link on my website for anything you want to chat about, and or connect with me on Facebook, anything like that. I'd be happy to get it to you.
Awesome. And then one more question came through. Is a cost plan an advantage plan type or something else?
A cost plan?
Yeah, is a cost plan an advantage plan type? Do you know what a cost plan is?
I'm not connecting with that term, but the
Okay.
person can certainly email me and we'll research that. And I'll figure that out. Cost plan.
Awesome.
There are high deductible plans. There are a couple of high deductible plans that I think sometimes are called a cost plan.
Yeah, I'm not sure. I don't really have.
I'm thrown by that question, but I'll figure it out if whoever asked the question, if they'll email me, I'll get to the bottom of it.
Yeah, so we'll have you email her, get that pamphlet, and you can ask your questions to have that conversation. But again, thank you for coming on today, and we'll talk to everyone again soon. Don't be afraid to reach out.
Thank you, Maggie, and I'm so proud to be part of the Purse Strings community, and I appreciate getting to be of service to our fans today.
Yeah, thank you.
Thank you,
All right.
Maggie.
Bye-bye.
Bye.